Hi there, and welcome to your experience as a volunteer with Open Arms Free Clinic. We are so grateful you've chosen to take your time and your talents and share them with our organization, and we can't wait to be on this journey together. So, for our initial orientation, we want to go through a little bit of background about the clinic, who we are, share some tips, tricks, and background so that you can start to really feel like you're part of the family. We're going to briefly go over the company culture, what our mission statement is, highlight our core values, and then a little bit of a history where we've been, what the timeline looks like, and a little bit about where we're headed. And then we're going to look into meeting the team, looking at some policies and procedures, some benefits and perks of volunteering here, a brief mention on the systems and tools that we use, and then some additional resources that you have as a volunteer. So, first of all, if you aren't aware yet, the mission of Open Arms Free Clinic is to better understand and serve with compassion the health and wellness needs of the uninsured, low income, and underserved residents in Walworth County. We do believe that our goal here is for our patients and our families, our patients and their families to have the same primary medical care and attention that we would want for our own family members. So, if you need a simple way to think of it, that's a pretty easy way to boil it down. And you might notice that I have some words here kind of in italics, and it's the better understand and the serve with compassion piece of our mission statement. And when we get into talking about our core values, I'll kind of go back to these pieces, but know that those are two parts of our mission statement that really make us who we are. So, first of all, the idea of better understanding, of really looking at who the human is that's coming through our doors, who that person is, what their story is, and how we might play a role on their journey, rather than maybe pre-assuming what we may or may not know about them, but really trying to take the opportunity to pause and better understand the people that are neighbors and members of our community. And the other piece is serve with compassion. So you're going to hear the word compassion a lot. It is in our mission. It is one of our core values. But in this brief orientation here, I'll explain what our definition of compassion means and how that looks in the open arms model. So, just a kind of brief picture of where we've been so you can understand. How it started and a little bit of what happened along the ways. This is by no means comprehensive. These were a few dates that I pulled that I always find interesting and notable. But of course, there are about 100,000 other things we can add on this timeline. And even from the time I put this presentation together, I probably ought to add a few more things on the end there now that we're deep into 2025. But back in 2011, Father Dan Sanders, he's the founder of Open Arms Free Clinic, he planted the seed. He was the one that really expressed the need for services like this in Walworth County. Father Dan was at St. Benedict's Church in Fontana at the time, and he had actually our very own Judy Johnson, who we can consider really one of the matriarchs of the clinic. Judy nominated Father Dan for an award. And when he did indeed receive that award and was giving his acceptance speech, he expressed the need for these kinds of services in Walworth County. As luck would have it, our current executive director was also in the audience of that speech, heard the call for, ringing the bells for a free clinic, and her ears perked up, and the rest is history, as they say. So Sarah has her master's in public health. She was looking for her place of belonging here in Walworth County as well. So being in the audience and hearing that sort of call to action from Father Dan really ended up being a serendipitous moment to bring us to, of course, where we are today. So I think we have a unique, kind of beautiful opportunity that we have an executive director that was the one that has been here since the beginning. So to see all of where we've been and help guide the work that we're doing going forward it can be really unique and really beautiful in all the chapters of our clinic. So anyway, so in 2011, Father Dan plants that seed. By 2012, we were treating our first patient. So in about a year and a half, there was a lot of discussions around kitchen tables. There was a core group of really wonderful people, heart-centered leaders in the community that knew that this was something that our community needed, but needed to put it together. What was the business plan going to look like? How was this going to work? How are people going to know about us? So they did all that work in a really true kind of grassroots way of building it, and they will come. And come they did. And we were able to treat our first patient on December 6, 2012. And we actually now commemorate the date of seeing our first patient with our gala every year. So with our annual fundraising gala every year, that is the first weekend of December. And that really commemorates that first birthday of the clinic. So that first opportunity for us to treat a patient. And then we've really just been going from there. So by 2019, we had purchased a dental office. Up until that point, we, of course, were already seeing the need for dental services in Walworth County, and we were doing some dental work out of our medical clinic. I think we had one of our clinic rooms we were using as a dental room, and just kind of piecing it together and doing the best that we could. And then by 2019, though, we were able to purchase the dental clinic. So in those first really 7 or so years, we went from a one room in a strip mall across from Elkhorn High School into the building that we're in now, into our current medical clinic and our current dental clinic. So a whole lot of growth there in the beginning. Then, of course, by 2020, COVID hit. So we had just really gotten our wheels turning with dental. We were in a rhythm with the medical clinic, and then COVID hit, and Open Arms at that point really kind of pivoted and many times pivoted, and I say stretched our public health muscles. So we were doing vaccine clinics, mobilizing our volunteers to do testing sites, continuing to distribute medications, and so our clinic never closed, and we found ways to support within the community the best that we could, of course, while that was unrolling. So post COVID, that is when I think a whole lot of additional change, that is when a lot more of this growth and building has happened, and some of what you will see around you now. By 2021, we had built a partnership with Marquette Dental School. The Marquette Dental students are the ones that administer care in our dental clinic under the supervision, of course, of a preceptor and now an additional dentist that we have on staff. We started to add more paid staff as the sort of foundational structure to make sure that the day-to-day clinic operations were going to continue running. Of course, COVID shifted what volunteerism looked like. Some folks that were retired let go of their licenses. The burnout became very real and very apparent after that time. So we just saw a lot of shifting around 2021. That is when I joined the team, and it's fascinating to see the growth from 21 even to now. So by 2022, we celebrated our 10th birthday and really started to focus our efforts on long-term sustainability. So we were no longer identifying as a sort of baby clinic or a startup clinic or anything like that, and had decided, we're really turning the corner here. We ought to consider what that looks like. So do we need to retell some stories? What stories do we need to tell? How do we continue to recruit volunteers to do this kind of work? How can young people learn from the wisdom keepers that we have within our four walls? How can we get out into the community more and get to people that are not coming to us, even though we know the need is there? So just started asking a lot of questions, and then looking internally to really say, okay, what needs to be in place so that whatever happens, this clinic can be around, because we know the need is there. So, and then I say present day that we are continuing the magic of our mission. There are a whole bunch of things I will add on to this timeline. But for now, that's a brief history of Open Arms. Okay, so I mentioned that we were really looking at focusing on long-term sustainability and what does that mean for us. So one of the things that came up was considering what our growth was going to look like, what are some of those dreams, and if we grow, how do we ensure that through phases of growth we stay true to who we are? The core of who we are, the mission of Open Arms. When you run a mission driven organization, how do we make sure that we always have our eyes on that mission and the work that we do continues to support that, regardless of how big we grow and what that can look like. So one of the exercises we did was to settle on our OAFC core values. So really trying to put some words to what we feel, what a lot of us feel just by being in the clinic. So uh, there are sort of energies that a lot of us are attracted to and say, oh, it's a place I want to be, and why is that? And so this was sort of our effort of trying to define that a little bit, and really be clear on who we were, so that anybody, as a volunteer, a staff member, a student, anyone that came into our organization, really would understand the environment in which they are going to spend time. So I am going to spend a little time here because this is, I think, really core to understanding the work that gets done. So I'll go through each of these kind of one by one and give some examples of why we chose the definition for these words that we chose. So the first value that you're going to see here is dignity. So this one was a relatively easy one to settle on. Our definition, of course, is we believe all humans have equal value, period. Hard stop. So that is of course, just the idea that we want to lead with human-centered care. So humanity first, looking at quite literally our neighbors in need and saying, I see you, you're here, let's go on this journey together, and let's sort that out, because everybody ought to be able to take care of themselves and their families, and et cetera, et cetera. The next value is trust. We build trusting relationships by being professional, competent, and accountable. So when we were first thinking about values, it was very easy to think through core values as they pertain to our patients and to our patient care. Wonderful. But we wanted to make sure that it was really comprehensive, because we are stewards in the community, not only in how we do patient care, but also how we manage the money that is donated to us, and the time that you all contribute and donate to our organization, and what kind of partner are we to other agencies and things like that. So these middle three values here, trust, collaboration, and flexibility, you might notice that my sort of description of them will touch on a number of our partners. So for trust, we want to make sure that the understanding here is that this is high quality medical care, high quality dental care. It's a high quality healthcare environment that people are entering. This is not a free clinic and therefore less than. It is trusted care amongst our partners and amongst our patients. So the other piece of that is the effort it takes to build trust within our patient population. So folks that want to come and get care at Open Arms, they may not know what that looks like. They may not know who we are. They may not trust sort of medical systems as a whole, whatever it might be. And so we do spend a fair amount of time working on building those relationships to make sure that patients do trust us and do feel safe and comfortable coming into the clinic. And we could say that really with any stakeholder. So we try to do the same for volunteers, for students that are choosing to intern with us, for folks that are considering donating to us. Trust is really the foundation of those relationships. So similarly, you'll see collaboration there in the middle. We wanted to, again, if I look internally here, the idea behind collaboration is that we are resourcefully leveraging our relationships to maximize opportunities for health. So you'll see the word relationships here again, because in a human-centered environment, that is truly what it is all about. And each one of us that operates within Open Arms kind of has relationships that work for different parts of the organization. So, for example, the pharmacy, when we get a $10 donation in the pharmacy, we're able to turn that into about $100 worth of medication. And that is because we have a relationship with an organization that we're able to get medications at a well discounted or free sometimes rate in order to give them to our patients for free. That's because we've built a relationship with a particular organization and proven to be good stewards of that relationship as well. This also collaboration also is really reflected in how we do our work inside of the clinic. So you may or may not see representations of this right away, but the focus, particularly in the last 3 years or so, has really been on an integrated care environment. And sometimes you're hearing that word kind of out in the world right now, integrative care, or we're an integrated environment, whatever that might be. And again, for Open Arms, what that means is that our departments, we have an opportunity to really work with one another in a very real time scenario. So, let's say somebody, maybe a patient comes in to enroll, and they came in because they want to see the dentist. And you're like, okay, that is great. Here's how we go through that process. But while we're talking to them, we start to learn that there are a couple of other things coming up, and perhaps they could be someone that might want to see a counselor through our behavioral health department. We're able to do, if the need calls for it, a warm handoff almost immediately. We are able to kind of tap in our coworkers and sometimes other volunteers and really start to pull together resources as we see fit for the human in front of us, because it is not all kind of perfectly black and white when you are leading in a kind of human-centered model. So being collaborative with one another inside our four walls and inside of our Walworth County community is truly the only way that we can make this work. Now, flexibility, I alluded to this a little bit, but the being in the business of humans can be kind of messy sometimes, because humans can be messy. And so flexibility is really a required core value. I know some of you will be hearing this recording and seeing this perhaps for your first time as you're joining us for one of our micro clinics. And that is so exciting, but it's going to require some flexibility. And this is where we ask you as the volunteer to be courageously curious to best adapt to the needs of our patients. So this is where we say, please show up. Just show up and just try, and we're going to do the next best thing, and it's going to be okay. We know, again, that our intentions are good and pure, and we are a strong and well resourced team. And so because we have that structure, we're able to then bend and be flexible where it applies and where it makes sense to be to allow for better care for our patients. So we cannot apply a black and white rule to most of what we're doing. That's just not really how it works in nonprofits, and it's not really how it works with humans. So we do require that value of flexibility. Now, as promised, I will talk about compassion again, and I will tell you that our definition of compassion at Open Arms is empathy in action, sharing the human experience. So I think you've heard me say this now a few times, but we are interested in being on a journey alongside someone. So not an us versus them, or a we are helping those people, none of that kind of language, but rather we are humans, we are in a community, and we want everybody to feel better and do better. And this is how, this is one way we're going to do it. And our belief is that a healthy community is a working community, is a happier community, and everyone deserves that when we're looking at humanity kind of as a whole. Okay, so a little pivot here as we went from our core values. That's really meant to give you just like the feel of the environment and who we are, and some of the why behind what we do, and hopefully I painted a little bit of a picture for you about what it ought to feel like as part of our care team. But I wanted to also just highlight the what of what we do. So you might know all of these things or none of these things, so I'm going to highlight some of them. Again, not really a comprehensive list, but these are our main service areas. Within these areas, we do a number of other things. So first of all, we are primary primary medical care. So right here, we're primary medical care. What that means, we're not an urgent care. We're not in an emergency room. We're not super specialty care where you're going to go and get, bone density scans and x-rays or anything like that. But we are the person that is going to be your medical home. Okay. So primary medical care, we're dental care. We have a fully functioning six bay dental clinic right across the parking lot, as well as an additional operatory for our full-time dentist that's just recently joined the team. We're also behavioral health care. So we are able to do telehealth. We're able to do individual, couples, and family counseling, and periodically are able to offer group counseling as well. We do have vision care. So when you are able to go on a tour, you'll see that room as well. We have some more comprehensive vision care, and then we also have some more basic options such as retinal scans. We offer medications. So we have our on-site dispensary that is available for people that are patients of ours. And again, it's getting medications at no cost. We have lab services, so a partnership with Quest Diagnostics, where we're able to draw your blood and run the labs, just like you might experience in a different medical system, and send those out and get the results back in order to obviously track your progress throughout your time of care with us. And then we also do care coordination and accompanying others. I added on the list, but those are two I'm putting together only because they can be really comprehensive. They can cover kind of all of the extra stuff, a lot of the extra magic that we offer that make us who we are. So could folks go elsewhere to get primary care and dental care and vision care? Yes, they could get those services elsewhere, and possibly also some of this care coordination but care coordinating and then the accompanying others. The idea of doing this together and being on that journey together, those are some of the differentiating factors for Open Arms, and just the way that we're able to wrap around people and connect them with services throughout the community that we know still affect their health. I will say, in addition to this list, we have a mobile medical team. So we have an outreach team that does outreach events out in the community and offer mobile medical services, blood pressure clubs, patient education, and we're going to different schools, libraries, community centers, employment sites to really try to meet people where they are and continue to increase that access to medical care. And we do a lot of that in the summer months. And then in the school year, that same team is working heavily on the Seal a Smile program, which is the school-based oral health care program. And we're in all, I believe it's 33 schools in Walworth County, doing basic hygiene checks and sealants on children throughout the county. Sometimes their first experience with a dental team. And then we are able to refer those patients back to our own dental clinic if need be and if they were to qualify. So, and then finally, a focus here in the last year or so has been a real look at, or really the last couple of years, a real look at workforce development. So what does this next generation look like? And so we do offer a junior board, which is kind of the first way to dip your toe into the Open Arms pool. That is open for high school students. We meet once a month. So a club for those folks. And then the Summer Select internship program, which is for college age students that are interested in community-based healthcare. So a little note here that there is something for everyone at Open Arms. So I often get the comment, I don't know, it's so wonderful, but I'm not a nurse, so I don't know what I could do. And I say, well, I am not a nurse either, and neither is she or him, So a lot of us are not medical professionals and have super valuable roles, of course, within the clinic, and you too will fill those roles. So I listed a number of these kind of in our little word bubble heart there, but know that the way we handle our volunteering is to say, just come and see, get a little taste of who we are and what we're doing, and let's have a conversation. What brings you joy? What is useful and value added for the clinic? What would be impactful? And we go from there. So it is a really a conversation that helps us kind of craft a good mix for someone that might be interested in choosing us and giving a bit of time and energy to serving others in their community. So This is a kind of less exciting page, and I'm not going to actually talk through all of these in too much depth because I will have a just a link to a document that we'll need you to read through and sign, and it's going to cover our ethics and confidentiality, and then a number of our like policies and procedures for volunteers. There, some of them are one sentence, they're two sentences, but just some quick information that are questions we get asked pretty regularly or things we need you to know while you're here with the clinic. So how should we come dressed? What does that look like? But of course, those are things to know, read through the document, and then understand. I am going to just say out loud that our ethics and confidentiality, you will have the opportunity to read through those pledges, but please know that what that says, kind of the highlight is that ethically, we take no money in exchange for the work that we do. No money, no gifts, no prizes, nothing like that. And for the confidentiality side of things, we follow HIPAA the same way any other clinic would follow HIPAA. So you may have access to a lot of private patient health information. You might have access to even donor information, whatever it might be. But we have everyone sign ethics and confidentiality pledges so that we can make sure we're really upholding that value of trust. And then the couple other things I'll just point out down at the bottom: clinic owned property, technology use, things like that. Those are pretty boilerplate. We mainly just ask that you are respectful of those of us around you and the property and technology that you're going to use. And then I like to point out active team player because we almost don't just ask, but almost require it. We really, really want your input. We want you to say, hey, what about this? Hey, I have this idea. Here's the thing I observed. I'm seeing a lot of patients come in with XYZ. We built who we are today because of volunteer feedback, volunteer questions, ideas. So please don't be shy about what that looks like, and engage in the work that you are doing with us. Okay, finally, this is more of an onboarding checklist as you come in and start to volunteer at the clinic a little more regularly. So let's not worry too much about all of these today, but the important one is going to be this: sign this document. So we will send this document over, or in this presentation, you'll be able to click through this link, and it is the Ethics and Confidentiality Pledge and the description of our policies and procedures. So we'll just need you to go through and sign that, and then you're kind of official and you can be on your way. Finally, just a quick thank you. Really, really thank you for being on this journey with us. We know it is going to look and feel different for everyone, but know that there is a place for you here, that your time is deeply valued by all of us, that are just here to provide the framework for all of the time and talents that you all are willing to contribute to our organization. And it allows us to serve exponentially more patients every single year. So we're looking forward to the journey, and here we go.